Is cancer curable? Can I get cured of cancer? This question we get asked many a times in our OPD. And yes, after the diagnosis of this disease, everybody wants to know only one word. Is it curable? How can I get it cured? Now, my dear friends, cure in cancer depends on many factors, and it is not related only to the disease or only to the treatment. There are a lot of other things which means cure. And what is the exact terminology? Which are the cancers can be cured? Which are the cancers which cannot be cured? And how can you do your best to cure this disease, cancer? So let me welcome you to Innermbbs. Yes, Innermbbs is your true inner hidden doctor, your mind, body, breath and soul. Welcome. So cure in cancer is just not dependent on the treatment duration, that you take 6 months treatment and you are cured, or you take 2 months treatment, or you do some surgery, do some treatments and then it's done. No, the cure in cancer depends on many factors. So to broadly understand, there are patient related factors and disease related factors, right? So patient related factors which depends on cure are the patient's general condition. Now see, all cancer patients don't look very sick. In fact, most of the cancer patients, they just look like you and me. They are very fit. Now, if a fit patient comes with a diagnosis of cancer, definitely the chances of cure are high, because whatever is the stage, whatever is the cancer, this fit, so fit looking person or patient will be able to take all the treatment, and somebody who can is able to take the treatment is at a better advantage of getting cured. Now this is a very generalized statement for understanding, but yes, cure depends on the fitness of the patient. Definitely a patient who is fit, who has a good heart function, liver, kidney is functioning well, there are no major illness apart from this cancer, they will definitely do well. So do not judge yourself just with the diagnosis of cancer. If you are a fit person, you will definitely do well with the treatment of cancer. Now, patient related factors, most important is how is the patient's general condition and whether there are any other comorbidities. So if there is none of these, then there are high chances of cure. But this is a generalized statement. Now let's come to the specific. What are the disease related factors which will tell you whether it can get cured or not? Now, all cancers are not same, and all cancers are not curable. Now, to broadly understand, any cancer which is detected in early stage, meaning stage 1 or 2, is around 90 to 95% of the times completely curable. Yes, I'm not joking. Whether it's breast cancer, lung cancer or any other cancer, if it is in fact the large intestine cancer, pancreatic cancer, so if they are detected in very early stages, stage 1 or stage 2, then they are completely curable. So cure depends on what stage is the cancer detected. Early stage leads to near complete cure. Now there are certain cancers that even if they are detected in the advanced stages, still they are completely curable. Yes, my dear friends, there are many cancers wherein stage doesn't matter, they are completely curable. For example, lymphoma and choriocarcinoma and the various germ cell tumors. These are certain varieties of cancer wherein stage 4 doesn't matter, they get completely cured. Again, in lymphoma we have many different types. So now don't question me that no, somebody I know that did not get cured. Yes, there are 10 to 15% of lymphomas, like the T cell lymphomas or the very high grade lymphomas, they are not curable. They have high chance of relapse, and then we have to do even the bone marrow transplants and other newer therapies, the CAR T cell therapy, right? We'll talk about all these in the upcoming videos. But to broadly understand, lymphomas are the best cancers to have, and they are completely curable in spite of stage 4. Isn't that a good news? Don't you feel so reassured and happy that all cancers are not same? So cancer cure, yes, patient factors, disease factors. Now disease factors, most important is the stage. Early stage is completely curable in 90 to 95% of the cases. And why am I saying 90 to 95, not 100%? That's because in every variety of cancer, there is this 5% of aggressive variant where the treatment will not make much difference. But But on the whole, 90 to 95% of the times, early stage cancers are completely curable. Now, the stage of the cancer, and the second I told you about the type of the cancer. So if it is lymphoma, germ cell tumors, choriocarcinoma, they are completely curable. And now you think that okay, patient related and disease related. So this is what matters in cure. No. The third most important is your inner MBBS framework. How much positive are you during the treatment? What is your attitude towards life in general? What is your attitude towards this diagnosis of cancer? What is your attitude towards the treatment, towards the doctor, towards the hospital? So your attitude will matter a lot. Now this is not just a motivational statement. Yes, it impacts, because the way we think and have the attitude, this affects our DNA and functioning of the healing mechanisms in the body. So I always say my patients, medicine alone will not work. So don't blame the medicine. Don't blame the doctor. Okay? So your medicine alone will not do anything. Your medicine will work only if you work. Yes, you heard it right. Your medicine will work only if you work. And what do I mean by this statement? Only if you work means you have to activate your inner healing mechanisms, and that's where the inner MBBS framework is going to help you. Because if you just take the medicine and you have this fear, anxiety, doubt, and a lot of depressive thoughts coming, a lot of doubts coming especially, then that medicine will not do the magic. You need the positive environment for the medicine. You know, there are many studies which have shown that just by gratitude, by positive thinking, by being happy, by being more mindful, you know, all those holistic practices which I mentioned in my channel, these actually increase body's immunity and healing mechanisms. And imagine if the inner healing is activated and the medicine is being given, you know, both aligned, the outer medicine and the inner medicine, when they are aligned, that's when you get maximum benefit. We see in our practices also that patients who maintain a holistic lifestyle, a positive attitude, they definitely do well. And one more scenario is, see, don't believe the reports. Even if the reports are bad, you have a good general condition, don't worry too much about it, because the worry which we create, the fear because of the worry, the stress because of the worry, that's damaging the disease even further. So always try to maintain, try to have that balance and fight out this disease. Cancer is not a death sentence. It's not a deadly sentence. Cure in cancer is possible. Cure in cancer is possible, my dear friends. I wish to bring about more awareness in the upcoming videos. Please share what was your biggest takeaway and what else you would like to hear from me. Thanks a lot.